Welcome to this explainer. If you're watching this, chances are you, or maybe someone you love, is navigating the incredibly complex and, let's be honest, often overwhelming world of fertility. You know, the desire to have a child is just such a profound, fundamental part of life for so many of us. And facing infertility, well, it can bring a massive emotional toll. It's stressful. We absolutely validate that angst. But today, we're going to flip the script. We're shifting the focus away from that stress and strictly toward empowerment. We're going to dive into the actionable, totally science-backed lifestyle adjustments you can make to actively take control of your IVF journey. Think of this as your ultimate guide to teaming up with your partner and your medical team to maximize your chances of success.
Okay, let's dive right into this. To make things easy, we've organized this whole prep process into 5 really clear, manageable pillars. We're going to cover understanding IVF basics, fueling your fertility, essential lifestyle adjustments, supplements and sperm health, and finally, mastering mind and environment. So, let's kick things off with Pillar 1, understanding IVF basics, the foundation.
Now, just to quickly ground ourselves here, in vitro fertilization, which you probably already know, is a highly advanced reproductive technology where the father's sperm and the mother's egg are fertilized in a precisely controlled laboratory setting. Then the healthy embryo is implanted directly into the mother's uterus. We're bringing this up because it remains literally the most effective assisted reproductive technology out there today. And truly understanding the exact science behind it, that's exactly how we optimize for it.
So, what does this all mean for you? Well, the absolutely crucial point is this time frame, 3 months. You might think, preparation just starts the day you walk into the clinic. But actually, doctors strongly advise that both the mom-to-be and the dad-to-be start physically preparing exactly 3 months in advance. Why? Because it literally takes that long for the body to produce healthy eggs and for the dad to generate healthy sperm with the full potential to actually fertilize that egg. The prep work before the procedure is just as essential as the procedure itself.
And that perfectly brings us to our second pillar, fueling your fertility, or as I like to call it, nourishing the team. Preparing your body for an embryo is a lot like preparing a garden for a seed. It starts with what we put on our plates. A nutrient-dense diet protects your cells and gives you the exact minerals you need for healthy reproduction. The fundamental shift here is actually super simple, as this brilliantly illustrates. You want to move away from anything in a package and pivot toward fresh, whole foods. So we're talking vibrant green leafy vegetables like kale and spinach, whole grains like brown rice and quinoa, legumes, beans, and fresh berries. On the flip side, you really need to cut out foods high in sugar and fat and absolutely ditch those processed and packaged foods.
But it gets even more specific than that, and I honestly love this because it perfectly highlights the whole team effort vibe we're going for. Each partner has a very specific dietary mission. For the mom-to-be, the goal is nourishing the womb, slowing egg degeneration, and accelerating ovulation. That means loading up on things like potatoes, soy, milk, yogurt, salmon, avocados, and olive oil. Now, for the dad-to-be, the target is producing highly motile, super vigorous sperm. So his menu should feature walnuts, tomatoes, garlic, oysters, beef, pomegranate, and yes, even chocolate. You are quite literally eating for a shared mission, just using different, specialized tools.
Moving right along, let's transition to Section 3, essential lifestyle adjustments.
Because beyond the kitchen, your daily habits play a massive role in creating that perfect environment for an embryo to thrive. And this number, 50%, it's a gentle but incredibly powerful wake-up call. According to medical data, excessive caffeine consumption can actually lessen your chances of a successful pregnancy by up to half. No way, right? Half of your potential success could literally be drained away by your coffee habit.
But hey, don't panic. You do not have to quit entirely. Doctors just advise limiting your caffeine consumption to about 1 to 2 cups per day. This is such a highly actionable, immediate step you can take today to regain control of those success rates. It's really all about moderation, not total deprivation. Now, there are a few other non-negotiable physical rules to keep in mind here. Maintaining a healthy weight is absolutely vital. Specifically for Asian populations, a healthy BMI is considered under 23. And the best way to maintain that? Gentle movement. Think walking and yoga rather than super strenuous, exhausting activities. It's also absolutely critical to avoid smoking entirely and steer clear of large amounts of alcohol. Why? Because smoking and heavy drinking actively damage sperm DNA and directly interfere with successful embryo implantation. They essentially fight against the very treatments you're investing so much in. And then, of course, there's sleep, the ultimate totally free fertility booster. Doctors strongly advise getting 7 to 8 hours of sleep per night. Why? Because sleep is the designated time when your body's organs and metabolic processes actually rejuvenate. To really optimize this, try to stop eating about 2 to 3 hours before bedtime. Oh, and you know that limited caffeine we just talked about? Make sure to avoid it for at least 4 to 6 hours before you hit the hay. It's a simple, nightly reset for your whole reproductive system. All right, let's shift gears to the fourth pillar, supplements and sperm health.
While a ton of the physical burden of IVF obviously falls on the mom, this phase shifts the focus over to the medical and environmental protocols specifically for the dad-to-be. Let's look at the supplement team-up. For mom, folic acid is an absolute must. You want to start that 3 months prior to prevent any brain and spinal abnormalities. Vitamin D is also huge, taken under a doctor's supervision, of course, to really support the pregnancy. For dad, the focus is strictly on keeping that sperm robust. That means loading up on vitamins A, B12, C, and E, along with selenium and zinc. These specific micronutrients are exactly what keep the sperm healthy and totally ready to fertilize.
Now, what's really fascinating here is the environmental focus for the father. Sperm quality is incredibly sensitive to temperature. Because of this, doctors specifically say you've got to keep the testicles cool. That means completely avoiding hot tubs and saunas and absolutely no soaking in onsens. It also means tweaking some everyday habits. Don't rest warm laptops or notebooks directly on your lap, and you'll even want to temporarily refrain from bicycling. All of this is just about protecting the quality and motility of the sperm in those super crucial months leading up to the procedure.
And as we get closer to the actual clinic day, there's a very specific final countdown protocol for the father-to-be. Step 1. Drink at least 2 liters of water daily to stay perfectly hydrated. Step 2 is a big one. You need to refrain from sexual intercourse, masturbation, or ejaculation for precisely 3 to 4 days prior to collection. Why so specific? Well, this exact abstinence timeline basically guarantees step 3, yielding the absolute best, highest quality sperm volume for the laboratory's rigorous selection process. You're giving the clinic the best possible material to work with. Which brings us to our fifth and final section, mastering mind and environment.
This is the final polish, where we focus on removing hidden external hazards. Doctors aggressively advise clearing out hidden chemicals during your IVF prep phase. You basically need to audit your home. You want to completely ditch any BPA or phenol-containing food packaging. Check your bathroom for paraben-containing soaps and toss them out. And in the kitchen, be super wary of kitchenware stain repellents made of perfluorinated substances. These invisible, sneaky little chemicals can quietly interfere with those reproductive hormones we've been working so hard to optimize.
Okay, so we've talked a lot about the physical stuff, right? The diet, the supplements, the chemicals. But we really have to pause for a second and ask, but what about the mental toll? Navigating infertility causes immense stress, and going through potentially multiple rounds of IVF, wow, it can test the emotional limits of literally any couple. The psychological weight is heavy, and feeling that way is entirely valid. Because of this heavy mental toll, doctors actually specifically prescribe joy. They highly advise couples to consciously think positively, encourage one another, and actively engage in activities that help your body release endorphins. You know, those endogenous, natural, feel-good chemicals in your brain. Easing your mind isn't just a nice, fluffy piece of advice. It genuinely reduces the physiological stress responses that can fight against the IVF process. Your mental health is an absolutely vital component of your overall fertility health. So we've covered a tremendous amount of ground today. From understanding the clinical baseline and overhauling your diet, to tweaking your sleep, managing those supplements, and clearing out environmental toxins. You've seen exactly what the science suggests. You now have the blueprint. So the only real question left is, how will you and your partner team up today to take control of your IVF journey? Thank you so much for joining me for this explainer, and I am genuinely wishing you the absolute best on your path to parenthood.